President of the Pharmaceutical Society of Nigeria, PSN, Professor Cyril Odianose Usifo, demonstrated his intelligent leadership prowess in tackling the availability and accessibility of essential drugs and medication in the country. This remarkable feat was achieved at the first of its kind interactive meeting with the pharmaceutical stakeholders, tagged Dinner with the Honorable Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, CON. The historical event took place at the Lagos Marriott Hotel in Ikeja, which saw the presence of notable individuals in the pharmaceutical industry, such as Prince Julius Adewale Adelusi Adelui, OFR, MNI, who chaired and was chief host of the event. A prominent figure in pharmacy, former health minister, and the current chairman of the MTN Foundation. Other distinguished guests in attendance included the Director General of NAFDAC, Professor Mojisola Christiana Adeyeye, the PCN Registrar, Ibrahim Babashehu Ahmed, the Vice Chancellor of Chrisland University, Professor Chinedum Peace Babalola, FAS, FPSN, the Director of NIPRID, Dr. Philip Builders, and several pharmaceutical chief executive officers and directors under the umbrella of FENPIA, PMGMAN, APIN, PSN, Neuropharm, IPMIN, and NAIP. In his speech, Professor Cyril Odianose Usifo congratulated the Honorable Coordinating Minister on his appointment and expressed appreciation for the restoration of funding to the Pharmacy Council.
Honorable Minister, I am here on behalf of over 35,000 Nigerian pharmacists to extend our heartfelt congratulations on your appointment as a Coordinating Minister of Health and Social Welfare. Your dedication to public service, extensive knowledge, and remarkable work ethic have been exemplary throughout your career, and it's truly inspiring to see your continued contributions to the betterment of healthcare and social welfare of our nation. Your versatility, hard work, and outstanding education are a testament to your commitment to excellence in all endeavors. We are confident that under your leadership, our nation's healthcare and social welfare initiatives will reach new heights of success, positively impacting the lives of countless individuals.
He focused his address on three critical issues, namely emphasizing the role of pharmacists as primary healthcare providers and routine vaccination, the availability of essential drugs in government hospitals, hindered by the Drug Revolving Fund, and the enrichment of the Drug Management Agency through public-private partnerships. Dr. Oke Akpa, the CEO of SKG Pharma and President of the Federation of Nigerian Pharmaceutical Industry Association, FENPIA, also took the opportunity to address statutory setbacks faced by FENPIA. These setbacks also revolved around the reduction of the cost of medication and its affordability in the country.
The first challenge we have is the challenge we are facing with foreign exchange. Honorable Minister, the pharmaceutical industry is heavily import dependent, like you know. Both from the raw material, packaging material to the finished products, all are imported. Therefore, this makes our industry highly at risk at any time. The foreign exchange that denominates this input is not favorable. We are aware of the current foreign exchange regime in the country, which makes it difficult for special applications and that, and I've discussed this with you, and I've fed back to some members. But Honorable Minister, from the last time we spoke to you now, things have gotten a bit more challenging, if you like. And so it is still our earnest prayer that through you and your team, that government finds a way providing some access to foreign exchange to the whole pharma value chain at a rate that will moderate the cost of drugs.
The Honorable Coordinating Minister, Professor Muhammad Ali Pate, CON, in his response, declared the event the first official consultation forum with him and expressed his interests in continuing such forums on a quarterly basis. He addressed the issues raised and pledged his support and collaboration with the pharmaceutical industry.
This is also the first meeting, I would say, of the National Consultative Forum of the pharmaceutical healthcare value chain in Nigeria. We can take this as the first consultative forum and plan for the second one and plan for the third one. Every quarter, let's have something like that. Maybe not the full group. The importance of really rigorous science, research and development as a clinical research organization, clinical trials capacity that links to manufacturing, and that culture of innovation goes to the whole ecosystem of various entrepreneurs, small, medium, big size, all competing, producing value that enable and that build the talent that is necessary to drive the industry.
The Lagos State Governor, Babajide Sanwo-Olu, represented by Dr. Oluwakemi Ogunyemi, spoke about the readiness of the Sanwo-Olu administration to collaborate with the pharmaceutical industry and partner with federal agencies to develop the healthcare industry.
What we can do, whatever we're going to do in Lagos as a state, we're going to follow what the federal does. Right now, we have programs to mitigate the cost of drugs, so we're doing things like free antenatal care, outreaches, and stuff like that. We're also working with international partners who do give us some funds. So we're on the same page. We're with you, and you all know you're in Lagos. The governor supports whatever it will take to give our citizens that relief.
The event concluded with a toast in honor of the Honorable Coordinating Minister, led by the Chairman of PMGMAN, Mr. Tosin Jolayemi. Professor Cyril Odianose Usifo, FPSN, expressed his joy in an interview with CEO Africa about the event happening under his presidency. He further expressed confidence in the minister and the president's ability to bring down the cost of drugs, making them accessible to the average person.
The first time such a thing is happening in the pharmacy world and it's taking place under my presidency. Two, is an opportunity for pharmacists to interact, and the minister, the coordinating minister for health and social welfare, was so happy and saw the complement of the array of titans of captains of industry and the people, and decided there's going to be a quarterly meeting. So we're expecting to meet again by the end of March, where we can thoroughly discuss more some of these issues affecting the farmers. We all know the cost of drugs are high, and we are determined to bring it down. Some suggestions have been made to the Honorable Minister, and I'm sure the Honorable Minister will follow through. Hopefully that will bring good things to the country. Right now we're in a critical state. The prices of drugs are going up, and something needs to be done to be able to bring the prices down so that the average Nigerian can afford drugs. Drugs that are not affordable cannot be accessed, and when they are not accessible, then the health outcomes becomes a problem in the system.
Professor Muhammad Ali Pate, CON, revealed that the industry players are now proactive and healthcare is a key part of the president's Hope agenda. He added that local pharmaceutical manufacturing is being pursued to allow the industry to thrive and subsequently reduce the cost of medication. The current administration is also actively wooing manufacturers to produce in Nigeria.
Rising cost of pharmaceuticals is a major issue that bothers all of us in government. As part of the President's Renewed Hope agenda, the health and welfare of Nigerians is key. And pharmaceutical manufacturing, local manufacturing is something that we are pursuing aggressively. In the last 3 months, we've had at least 3 major players exploring the opportunities to come and manufacture in Nigeria. And we do hope that many others will come in, that our local industries will thrive.
Dr. Kemi Ogunyemi, representing the Lagos State Governor, Babajide Sanwo-Olu, highlighted the major factors contributing to high medication costs and stated that the government is committed to bringing down the cost and organizing programs for free distribution of drugs. She emphasized that healthy living and prevention are crucial in healthcare.
What is making the drugs go up? Why they multiply? Why can't we afford it? So we all know about the economic status of the country, in fact global. One of the first things is, what can we do to enable the manufacturers why and produce the drugs in Nigeria? That's why drugs are cheap in India. They actually produce it. So we've heard today, for example, the taxes, the ease of doing business. So what the government can do federal level is remove the taxes, the importation fees, which is what some of them have said. Also in the states, we follow what the government does. So what we're doing in the state, for example, is we provide programs like free antenatal care for things we can control, so that the people are not paying for certain things and they can now pay for their drugs. Absolutely, the drugs are going off the roof. There's really not much we can do until the government intervenes, and we've got very, very good interventions that hopefully will come in place. Another thing we're promoting, which a lot of people are not talking about, is healthy living. You are going to you don't need drugs unless you're sick. So what are we doing to ensure and to make our people aware that you need to look after yourself? You need to eat right, you need to exercise, you need to prevent yourself from getting sick. So prevention rather than cure. Because the drugs that are expensive are drugs that are curative. So we are very, very deliberate in pushing preventive care rather than curative. So we don't want you to get sick. We don't want you to get malaria. The environment must be clean. So Ministry of Environment will make sure we have drainage, good drainage, so that mosquitoes don't stay around your area. So we promote things that use mosquito nets, where your children eat decent food, and of course, NAFDAC will try and prevent fake drugs. That's what we're also trying to do. So the key is, a lot of people say that this is the wrong time to be sick in the country. Absolutely, there's no right time to be sick. So we're doing all these things to help, and we're outreaches. We're actually, and then we're partnering with private sector. We're capitalizing on community social responsibility. So at these outreaches, they get free drugs.
Professor Chinedum Peace Babalola, FAS, FPSN, the Vice Chancellor of Christland University, Abeokuta, Ogun State, spoke on the need for better drug distribution control to prevent drug abuse. She added that Nigeria should strive to be a drug manufacturing country rather than relying on imports to reduce medication costs.
We are here in this dinner with the minister to let him hear that Nigeria needs to be a drug manufacturing country and not a drug importing country. Because if we are manufacturing, you first of all take care of your people before you start exporting. But if you're importing, then you need foreign exchange, you need this, you need that, you need that. Even the little we manufacture here, we just package. Almost all the raw materials are imported. So we must, all this unlocking the healthcare sector, let's go and intentionally about promoting manufacturing products in this country so that we can have access to the word is access and affordability. Access, affordability, and quality. So we must be able to empower Nigerians to manufacture, to distribute quality medicines at affordable price. And it is doing, like the minister said, they've gone to other countries where it has worked. So let us come here and see, we've talked so much The chairman said he's been talking since 1962, so you can imagine. Somebody said, I've been hearing it since I was born. I just pray that in this dispensation we will take audacious steps and break through and see what we need to do. We don't lack what to do to make this happen.
Pharmacist Professor Larry Pate, Dean, CEO of Business School Netherlands, emphasized the importance of collaboration in the pharmaceutical industry and its potential in reducing the cost and improving availability, affordability, and accessibility of medication.
The secret to the pharma industry is collaboration, and all the critical stakeholders in the pharma industry have collaborated thanks to the founding fathers who has worked assiduously till late in the night on daily basis to make this happen. And I think that unity of purpose was very clear to the minister, and that's why the minister will take the industry more serious than it has ever been. So I believe that unity of purpose has helped, the concept of collaboration which has provided, because the founding fathers of FEMPEA have used hindsight, insight, oversight, foresight, and farsight to put this together. Knowing fully well that it is when they stand as one that they'll be able to influence policies in government. And this has worked out. And it's just a great privilege and such a great honor and grace, divine grace, for one to have ended up as being one of those founding fathers. There are three major things that affect that is very critical that we have to quickly resolve: affordability, availability, and accessibility. And the industry can solve this problem in conjunction and in cooperation with the federal government. Because, like you know, healthcare is on the concurrent list. I mean, it's on the exclusive list of government, and as much as possible, they actually handle regulations and things like that. And it makes good sense for us to work with them. And through dialogue, the government will be able to understand why some policies will need to be in place to be able to help the people. They are there because the populace voted for them. So anything that's affecting the populace also make them uncomfortable. It is not born out of wickedness, it just has to do with the fact that on one side we want to achieve some objective, on another side they also have to be seen to have achieved some successes in policy making and in implementation. With this consultative group that is working with the industry's critical stakeholders, we're able to solve many problems that we did not solve before now.
Pharmacist Osareti Jayola FPSN, MD of Fentil MHP, described the Honourable Minister as a knowledgeable and experienced leader who understands the dynamics of the healthcare profession. His commitment to bringing everyone on board for the greater good of the masses was highly appreciated.
Today for me is a landmark event. It's an epoch-making event in Nigeria to unlock the pharmaceutical healthcare value chain in Nigeria. Today we had the Minister of Health, Professor Muhammad Ali Pate, a man which I would say a round peg in a round hole. He understands the dynamics of the healthcare profession, and he's going to act as the coordinating minister that he is to bring everyone on board. Doctors, pharmacists, nurses, everyone, all for the good of the patients of Nigeria. For me today is a lot of excitement. I have hope for Nigeria. The hope agenda has just begun.
Mr. Frank Moreme, the Executive Secretary of PMGMAN, expressed excitement about the engagement between the Honourable Coordinating Minister and the pharmaceutical stakeholders, viewing it as a turning point for the industry.
I am super excited to be one of those that witnessed this great event. I call it great event because this is the first time it's happening where we have a serving minister that the stakeholders, as a family, gather together to honor the minister and by so doing, create a platform to exchange ideas, come up with insights on how to overcome the numerous challenges in the industry, and of course, proffer recommendations and solutions to the many challenges. In fact, this is the first time it's happening, and I'm overwhelmed with joy. Overwhelmed with joy because, first, in fact, I am so impressed with the approach of the Honorable Minister. You overheard him say that this is not going to be the only time we're going to meet as consultation meetings. He said there will be a second consultation meeting and there will be ongoing consultation meetings. That this is the first. And he said before the end of March, we're going to have another consultation meeting. I mean, I am so impressed by the quality of the engagement between the Honorable Minister and the industry. If you look very well, this comprises of every nook and cranny, every stakeholder in the industry, be it the pharmacy practice, be it the manufacturing practice, be it the academia, be it the research, be it the regulatory, and for me, I want to put it this way: there's a strong nexus that connects everything, and the minister was able to see everybody in the room and have a meaningful conversation on how to overcome the mirage of challenges that are facing the industry. As you're aware, he made mention about the particular interest of the Mr. President, about how is he going to stimulate the industry to be able to cater for those most vulnerable in our communities, especially those that cannot be able to afford medicines. You and I know that access to medicine is very key, and with the many dynamics in microeconomics, the prices of medicines are skyrocketing, and I think the industry are well positioned to be able to cushion the effects of prices of medicine, the escalating prices of medicine.
Says Prince Adewale Oladigbolu, the national chairman of ACPN, described the Honourable Minister as a good listener who values teamwork in the healthcare system. He raised concerns about the operationality of the health insurance scheme and called for reduced tariffs on raw materials and finished goods, as well as a more responsive NAFDAC.
Luckily, we have the minister that listens. I've engaged with the minister several times on Twitter, that's the next media, and he has responded beautifully well. And you can see what has just happened today. It shows you that he's a minister that is listening, and the minister that wants to take the healthcare system in Nigeria from ground zero to the topmost level. He's a very well exposed man. He's a man that knows what teamwork is, and we have no doubt in our mind with what has happened recently that is going to take the health sector to the topmost level. One of the most important things is that let the health insurance work. If it works, it's the insurance that bears the brunt of this hiking price. The people of Nigeria, the patients, the clients, and people who use medicine in Nigeria will then be somehow immune to the cost of medicine, and then government will sit up and do the right thing. That is number one solution. The other thing that we need to do immediately is remove all tariffs from raw materials to finished products in the pharmaceutical sector, so that price reduction will be passed on to the final consumers. For medicines that are very scarce, ensure that NAFDAC becomes more responsive to the needs of the people. If a company is underproducing, then NAFDAC should have a portal where people will go and check and say, oh, okay, we still need more of this kind of product. And then more investors will come into the industry to bridge that gap so that there is no scarcity of medicine. It is very important to know that the more we produce in our own country, the medicine that we need, the better for us in terms of medicine security, in terms of prices of medicine. It's also very important to take note that right now, over 70% of what we need in the country is being imported, And as a result of that, prices of medicine are tied to the exchange rate. So, and when I say the exchange rate, it's good to consider the stability of the currency on one hand, and even what the exchange rate is actually. If the currency is stable, pharmaceutical manufacturers, importers can predict the trend of things, and they are able to manage their cost. But where there is a fluctuation in the exchange rate, then they will tend to overforecast, and then prices will keep going up. One other important thing is remove the layer of the open drug market and see price stability. Right now, because of open drug market, people can hold medicines, people can do collusive oligopoly, combine together to buy large quantity of medicines and sell it at any price that they need.
Overall, the event highlighted the proactive and dedicated efforts of Professor Cyril Odianose Usifo as a silent achiever and an infectious visionary leader, backed by one of the leading lights of pharmacy in Nigeria, Prince Julius Adewale Adelusi Adeluyi, OFR MNI, past presidents of PSN and other industry players in pharmaceutical value chain. The coast is clear for the pharmaceutical stakeholders in Nigeria and the policy makers to address the problem of affordability, availability, and accessibility of essential medication in the country. With this special support of the Honorable Coordinating Minister and the commitment of industry players, there is hope for a bright future in Nigerian healthcare industry. Dignitaries at the event include Professor Muhammad Ali Pate, CON, Coordinating Minister of Health and Social Welfare, President of the Pharmaceutical Society of Nigeria, Pharmacist Professor Cyril Odianose Usifo, FPSN, Prince Julius Adewale Adelusi Adeluyi, OFR MNI, the My Lord Pharmacy and Chief Host, Professor Mojisola Adeyeye, Director General NAFDAC, Dr. Oke Akpa, President FEN PIA, Chief Executive Officer SKG Pharma, Dr. Abdul Mukhtar, National Coordinator, Presidential Initiative Unlocking HC Value Chain, Professor Chinedum Peace Babalola, Vice Chancellor, Christland University, Chief Dr. Stella Okolie, OFR, Chairman EMSO, Sir Ifeanyi Atueyi of PSN Foundation, Pharmacist Ken Omwegbo, FPSN, National Chairman of Association of Industrial Pharmacists of Nigeria, NAIP, Pharmacist Dr. Joseph Madu, MCPAN, FPC Pharm, National Chairman of the Clinical Pharmacists Association of Nigeria, Bankole Aminu A. Ezebuilo, MD CEO, K Health Pharma, Mr. Chidubem Okoye, MD Jewel, Mr. Patrick Aja, MD M&B, Prince Nnaemeka Ugwe, MD Nemil, Dr. Fidelis Ayebe, MD Fitson, Mrs. Tony Utomaki, MD Biomedical Pharm, Mr. Tosin Jolayemi, Chairman PMG MAN, and a host of other industry players.